everybody. Come on in. Come on in. We're going to wait a few more minutes. Hi. We'll give it a few more minutes and we will let everybody come on into the room. All righty. Is everybody ready to get started? Kind of, sort of, not really. Well, hi. It's me, your girl. I'm back, Mully Tabor. And guess what? We are here. You can send your questions in the chat. We're going to be talking about managing your healthcare benefits today. And with me, your girl, Melissa Mully Tabor. I'm back. I took a long hiatus. Y'all know work, life, all those different kinds of things. Well, it took a toll on you, girl. And I really had to take a break. But otherwise, I'm back and we are ready to get started. So I know y'all want to know update. What has Community Health Partners been doing? Well, Community Health Partners, we have been doing our grassroots efforts, which, boots on the ground, right? And so that's what we got going, boots on the ground right now. And pretty much, so what we got going is we have been working with TennCare on these TennCare events, trying to make sure everybody keep their renewal and keep their benefits and keep everything that they need to get those services. Well, we did one last year in July and it was successful. So quite a few people were able to renew their benefits. And we did another one this past January, which was just as successful. And just as quite a few many people got to renew their benefits, plus as well as sign up with a lot of additional community health services. So one thing that I want to make sure everybody aware of is the Tennessee Justice Center, and they're based out of Nashville, and Community Health Partners works a lot with them, helping to make sure that people maintain the benefits, which is greater than TennCare, but they also help to maintain SNAP, and just different other kind of benefits across the board. But what we're going to focus on tonight, is the big TennCare gap. Hi, Valerie. Thank you for joining. So we're going to get ready to talk about this big old TennCare session that we have going on. And guess what? Y'all know me. I'm all about data and numbers and data, because that's what actually tells the truth. So no matter what we say, unless we have facts and data behind it, that's what really get people's attention. So let's start with the basic. Okay. So we're going to go with the very basic. So we're going to go here, right? And what we're looking at with this particular slide is the TennCare letters that was sent out. Okay, so let's talk about the history of this. Remember, the public health emergency ended last April, and I've been telling y'all that, that it ended last April, right? And right. So as a result, it ended last April. Now everybody have to renew their benefits. And if you look at the information we have on the screen here, what this is showing, ladies and gentlemen, this is showing the TennCare letters that are sent on a monthly basis from April last year all the way through March of this year. Okay. Now this is the number scheduled, the dates that the letters are scheduled to go out. And this is when their renewal is scheduled to be due. Okay. Now, if we look at the bottom part of this is that wonderful unwinding period. We always hear me talk about unwinding. Well, that's a fancy word made up by somebody somewhere. And what that unwinding is talking about, ladies and gentlemen, is the number of people that's going to have to be enrolled through this process as a result of the end of the public health emergency. I was going to say PHE, but as a result of the public health emergency. So we see April 50,000. And so now we're getting ready to be here February this month, and anticipated or expected 58,000 letters will be going out. And the final month will be March. 47,000 letters will be going out. And that will give a total of, at that time, it was approximately 864,000 recipients receiving TennCare that had to go through this unwinding period. Now, what I want to make sure everybody understands is when we're talking about this unwinding period, who is affected by these numbers? Who's really affected by these numbers? Well, I can tell you who are affected by these numbers. Anybody that receives TennCare benefits, okay? Well, let's define anybody. You have your regular everyday people who receive TennCare, children who receive TennCare. Now, there's one caveat to this that a lot of people may not realize, is that this may impact seniors as well, because a lot of seniors have TennCare for their secondary insurance, which will be a supplement to Medicare, which means those people as well will have to as well as renew. So it does not matter adult, child, pregnant mom, non-pregnant mom, man. You have men who are on TennCare, so let's not skip through that part of it. Like, is men not going to be affected by it as well? But men can be affected by it as well, because what happens is, ladies and gentlemen, this is a requirement to maintain your benefits. Okay. Now, the answer to the question is no. This does not only impact Tennessee, this impacts all states in America, right? Across the continental United States. So if you were receiving Medicaid, I don't know, some states it's called Medicaid, some states it's called something else. But if you are receiving these type of benefits, then that means, ladies and gentlemen, that you will have to renew at some point if you haven't renewed already. Now, one thing that's crucial, and I need everybody to understand, is you will only get one letter in the mail. You will not get a whole bunch of phone calls. You won't get any of that, right? That initial letter went out to you, and it went out to your last mailing address that you had on file with them. Now, if you moved since then that brought in a whole different set of factors, right? Well, guess what? Because now I want to go back to this and share this for a minute, because these numbers are going to become important. These numbers are going to become very, very important. And the reason why these numbers are important is because look at the numbers of letters that's being sent out. We have to question, is there staffing, right? Let's just be real here. Is their staffing adequate back at the ranch, at TennCare office, to reply to these number of recipients that's time for renewal, right? We know it's not. We know they don't really have the staff to respond accordingly. A lot of people have been disenrolled automatically, and so automatic termination for failure to respond. Well, a lot of those people got automatically terminated in error. They did respond. It's just that there was no staff there to receive them or provide the information that they needed to help them get renewed, right? So things within TennCare has been so chaotic as a result to the end of the pandemic, right? And for the record, there's some other benefits that's affected as well, right? So your SNAP benefits, yep, all of those things are tied together. All of those things are related. All of those have regulatory requirements where you had to renew this year, right? It was not a choice, right? So, but with TennCare in the state of Tennessee, they've had major significant challenges with it. They've had so many challenges, ladies and gentlemen. Guess what happened? Yes, sir, ladies and gentlemen. The Tennessee Finance House Committee, Ways and Means Committee, back in January, they had a special hearing on it, right? So yeah. So let's pop this out to the big screen so everybody can see what's going on here, right? And just for the record, nope, I did not make these notes up. I did not pull them out from random from anywhere. These are actual notes from the Tennessee House Finance and Ways Means Committee. They had a TennCare hearing back in mid-January because of the crisis, with so many people being automatically disenrolled or not getting the help they need or not getting assistance in a timely manner. Because what we have to remember, some of our most vulnerable people, right, are being affected by this. It doesn't matter what we say or what we do, we still have to remember that there are a lot of children out here that's losing their benefits, right? So when they called Dr. Smith down, the Ways and Means Committee called Dr. Smith down, they asked him a lot of questions. So pretty much what he said is that some folks didn't respond to receiving their renewal packets because their employment had changed and they no longer needed Medicaid. Well, that's a good answer, but sometimes, we just need a little bit more about that. Can you give us some numbers, approximation about how many people really need this? Now, Tennessee Justice Center, they went out and they did about 80,000 addresses after presumptive eligibility campaign, and they tested the reachability of those, and they were able to reach about 80,000 of them. But what makes it a little bit tricky is, where the family members, so that was the past, right? So let's look at where we are now. Each family member sees a total of 14 nudges from TennCare in the form of email and text. Okay, so email and text. Well, that's good. That's good. More people probably will respond to text versus email. And that can be tricky because depending on the age of the user or the age of the recipient, some may not respond to this digital age at all, because remember, we still have a digital divide, right? And so when you're saying you're emailing, texting people, if people are not up to technology or they don't have the equipment and they're stuck in the middle of that great digital divide, then you won't be able to reach them anyway. So, we just have to think of those people who are just somewhere in the middle, right? And we also found out, and this is what they're sharing with us, that some MCOs are reaching out, but TennCare is not informed of what MCOs are reaching out. So I don't know how to explain that. I'm not sure where they were going with that or what he was trying to say with that. But if the MCOs are reaching out to people, then what is TennCare doing? Because it's my understanding the whole process goes through TennCare initially, and then it comes down to the MCOs. But if everybody's just out here willy-nilly doing what they want to do, then everybody, the recipients, are stuck in the middle, right? Well, now look, we're going to go ahead on and give Representative Zachary Jason from Knoxville. He asks, "Has Tennessee saved money? If so, how much?" Dr. Smith feels it's too early, mainly because the PHE interrupted the pause. So, okay, so let's talk about this. So just to make sure everybody's what he's saying that because of the PHE, and everybody needs to know the PHE, the public health emergency, that references back to the start of the COVID, right? Remember when COVID first started? And it caused a public health emergency. And that's what he's saying, because of that public health emergency. And it carried on for almost 2.5 years, half of 2020, 21, 22, and some of 23. So as a result of that, all benefits and renewal, everything was put on hold. So as a result, he's unable to tell the benefits of that TennCare Connect. And because that TennCare Connect is where people can go online and they can sign up and they can renew. And that's what he was trying to answer with that particular question. But once again, because of the pandemic, then they were not able to do that. But then Representative Miller from Memphis, he asked about TennCare Service Center's ability to make outbound calls. That's a good question. That is a very good question, right? Are you actively following up with people according to their phone access instead of just digitally outreach? Which goes back to what I said earlier about the digital divide, right? Some people just do not have that capability. And if they don't have the capability to receive the calls, then how are you actually following up with them? What other means are you doing with them, to their phone access and just instead of the digital outreach? Now, Kim Hagen, she's assured us that they're doing that. Now, the last part of this is the trick part, is the real part of the question. Temporary staff were added. Those staff members will not remain at TennCare after redetermination. And that's kind of scary. So are they saying after March, when the last batch of letter goes out, right? After March, after the last batch of those letters goes out, will there not be any more, right, temporary help to help people? Or they're going to stay on to go on a little bit longer, maybe 3 or 4 months down the road? Because if we go back to this and we look at these letters that's being sent out, ladies and gentlemen, we see these numbers are in high demand, right? Just alone in February this month, they're sending out almost 60,000 letters. And in March of this year, well, next month, they'll be sending out approximately 47,000 letters. So, we just have to go back and look at the big scheme of things when they're saying that they are going to terminate or let go the temporary employees, right? Well, when are you going to let them go? Because we have to be realist here. When you let those people go, you're going to almost find yourself back into a bigger issue, just as you had at the beginning. So I'm just hoping that there is some type of transition plan to slowly decrease the number of temporary employees. We're not just going to go ahead on and yank all the temporary employees away at one time. That will make no sense whatsoever, none, because we don't know how many people really, and you're really concerned about those children and seniors will be impacted by this. So we just have to be mindful that, there are so many variables when you begin to remove that temporary help. And those variables will be those vulnerable families will lose benefits, right? And so when we say lose benefits, exactly what does that mean? For a senior citizen who has TennCare as a secondary, that means anything that TennCare was paying for them, they now have to pay for that out of their pockets. So we can say for a fact, we do know some seniors, they use that TennCare as a supplement to pay for their medication, right? Also, in some instances, if a patient or a Medicare patient is a Medi-Medi, there are some instances, right, when they can actually have their deductible covered. Now, let's get into the other side of that, those other variables, right? Children. What will happen if a child becomes disenrolled? A child will lose access to their primary care physician. A child will lose access to their dental benefits. If that child has something special going on, maybe he may have some behavioral health challenges that he needs to see a psychiatrist or a specialist. He may have a heart condition and he has to go see a pediatric cardiologist. All of that's gone. All of that is completely gone because that child was not able to re-enroll, mainly because of the volume of letters going out. And now you're talking about taking away the temporary staff. I think I probably would feel a little bit better. I really would feel a little bit better if they could just tell us more specifics about when they were going to let go of that temporary staff, because with almost 80,000 letters going out between February and March, there's no way you can tell me with any good conscience that it is okay to let those staff members go, especially at this crucial time, knowing what we know, right? Especially taking into consideration, hey, about 2 weeks ago, remember about 2 weeks ago, excuse me, yep, when we had the big storm 3 weeks ago, when we had the big storm, the big flood, we had all of those different things going on, right? Well, y'all remember that? Well, that shut everything down. Nobody had power. Well, some people had power on and off, intermittent power going back and forth. Everything was shut down. There was no internet. There was snow on the ground. People were trying to get water. Everybody was just basic survival mode at that point, right? And the last thing anybody thought about was renewing their benefits. That was the furthest thing from anybody's mind. But now, right? Now we have to think about that because all of that's over with. And now we're back to what needs to be addressed, right? And I just have to keep bringing these numbers up on the screen because I want everybody to be aware of how critical and how crucial this is, right? Do we see these numbers? So at the end, like I said, 50,000, almost 60,000 in February, and another 47,000 in March. That's a lot of people. That is a lot of people, ladies and gentlemen, that could potentially lose their benefits. So while everybody is working, let me give you a visual. Let me give y'all a visual, right? Not everybody. If you have local TV or you have regular TV and you're out there watching, have you ever seen that guy, little thin guy, and he's standing by the mailbox and he says, have you received your TennCare letter? And he opens up his mailbox and he gets the letter out, or he says, well, if you have or you haven't, it's time for you to renew. Well, it's not that simple, ladies and gentlemen. Excuse me. It's not that simple, ladies and gentlemen. What has happened is he's simplifying a critical, significant thing people need. He really made it seem like it was just that simple, that all you had to do was go and open it up, get the letter out the mailbox, and send in your renewal letter. Well, yeah, it is that easy to get the letter, but it's not that easy to get renewed at all. No. And I'm sure there are many people out here across America that can testify and say that, you know what? She's telling the truth. It doesn't matter what state you're in, Mississippi, Louisiana, Arkansas, Texas, doesn't matter. The same rules apply and everybody is being impacted everywhere. And so what I'm really trying to get people to understand is this is important because you need your health insurance in order to be well, right? You don't have to life alone, right? Everything is difficult sometimes. Life seems overwhelming. That's why we're here. That's why community partners are here. We have so many partner agencies that we partner with: the Independent Parent, Tennessee Justice Center, community resource agencies, all of these great different partners that we have. You don't have to life alone. And if you don't know whether or not your TennCare is renewed or whether or not it's time for your TennCare to renew, you can go out to TennCare Connect and see it, right? So, oh, we got a comment in the chat. Yay. He said there are too many people. Oh, wow. So I'm going to read you her exact message. Right now, there are too many people handling the paperwork when they're being recertified and causing a backup. Well, you know what? Too many hands in the kitty. No, it's not too many hands in the kitty. What she's saying is they got the help. It's just everybody trying to do the same thing instead of trying to put some structure and content to it. Everybody trying to do the same thing. No, break these people up and separate and put some kind of organization to it. And she said her sister just went through it. She said they should come up with more money to keep the temporary employees at least until June. Well, I'm glad somebody out here is listening and can understand the crucial significance of those temporary employees. And I agree, Valerie, they need to keep those temporary employees at least till June, or at least until they've gotten through a significant number of re-enrollments. Now, I didn't take time to break down the data or decipher the data like I should have. But when I go back and look at the data and get with my resources, and they're not making it easy out there at TennCare, right? A sister has to pull that data down week by week by week and try to manipulate it, right? That's no fun whatsoever. No fun whatsoever. So in doing that, I'm just going to go back, and when we come back on next week, I'll try to have some real stats and information for you where you all will actually be able to see where you all will actually be able to see the real numbers and the real disenrollments, because there are times that people just don't understand. Now, I'm going to be honest with you. The Latino population, they've been affected just as much as the people brown. They're brown as well, right? Our struggle is their struggle. Their struggle is our struggle. We all rocking in the same boat when it comes to getting assistance. People don't want to hear us. People don't want to listen to us. They want to give us a hard time. No, it doesn't have to be that way, right? It doesn't have to be that way, right? People just go out there, TennConnect, and you can get your benefits renewed. Now, also, what I want to share with you, ladies and gentlemen, if you don't have TennCare, but you feel you may be eligible because of a change in life situation, right? You lost your job, you are pregnant and you don't have insurance, your husband was carrying the insurance for you and now y'all separated or y'all divorced and he took you off of your insurance. Once again, there are so many moving parts to this that can cause people not to have insurance coverage, especially this time of, we really need to have it with all the mental health challenges going on. This cold and flu season going on. We need to get out here and get stuff. Y'all see my sinus and allergies. It's killing me. It is really taking a toll on me. But I fortunately had insurance and was able to go to the doctor and get something for these allergies that is really taking this toll on me. Well, ladies and gentlemen, this has been an awesome evening. I'm back, right? I think I'm ready to keep on going, right? And it has been fun. I hope you all learned something. I hope you all can go out to our website. You can follow us on Twitter at calmhealthpartners.com, or you can go on our Facebook at calmhealthpartners.com, or you can always go on the YouTube page, Benefits with Molly, right? But guess what? Oh, one thing that I didn't put in there is our website, and that is www.mycommunityhealthpartners.org. If you have any healthcare questions you'd like us to talk about, address you, concerns or issues, shoot us an email at information@mycommunityhealthpartners.org. information@mycommunityhealthpartners.org. Let me type that in there for you guys right quick, where you can send your questions to. All righty. And we're going to show this to you, right? information@mycommunityhealthpartners.org. It's the beginning of the year. Deductibles and copays. Copays and deductibles. Remember, ladies and gentlemen, you should never pay a copay and a deductible at the same time. It's either or. Don't let them tell you different, unless they're going to tell you, well, ma'am, you have a deductible on your lab, so you can pay your copay, you can pay your deductible on your lab. So if you have any questions, you have outstanding medical bills you need help figuring out, shoot me an email at information@mycommunityhealthpartners.org, and I will be glad to try and help answer your questions, your family questions. You have information, you need help getting appeals for your TennCare. Just shoot me an email, or you can always reach out with your TennCare questions to CECO, or you can always reach out to Tennessee Justice Center if you have any insurance questions, right? Well, ladies and gentlemen, that is my time for this evening. It has been live, it has been great, and it has been awesome. And I will see you all next time. Thanks for sharing. Tune in next week.